For all your pastry, bakery, and quality food, CK Restaurant is the only place to be. We do catering for birthdays, weddings, and all related services. We have all kinds of local foods, American, European, and even beyond. Come and have a taste of our local juice, ebe, and other services. At CK Restaurant, customer satisfaction is our priority.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3, or 4 bedrooms, or our story buildings, 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
When we touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see the
diwli lanni maaro lanni
fop lanni
awa joni mi anda honno gerde ten e ngal do sabu e ngal do Ibrahima jonnal taw joni mi anda se yahay kapitiki nyawlo den ha humpondire makko est ce qu'on non e warude
waden no awa
ane ko de Ibrahima ma ko to woni
mo Amerique
ko Amerique a woni kede humpitaki fi be musibe men baluwo be andanda kala ko wawda wonde aduna si arrivi e juude mabbe a jonnay do dépassement Gambia har no weebi ayata kadi taw ko mbudi din no jawi walla no jippi be halanta ma ko kala ko falda ko re sengo nyamete ili nebba maro basal pomme de terre kala ko rewi don a hendo to har no weebi kadi wona dum don tu be abbe jonnira mobile phone siko dum kadi laptop kala ko wayrode jibe ay kasbawa be wawma jonnute kadi sa fala humpitade ko weebi ƴettu Google account ma joni ndata ton waɗa download app maɓɓe on ayiyay kala ko humpi ma e maɓɓe ton ɓe weeɓi ha maɗa
ka wonɗa wo e aduna on
kala ko wawɗa
a jonnanayi wonɗo ka leydi men Gambia ɗo dépense
hara no weeɓi ha ma si ɗum non fof no neeɓi immoɗen joni mi ɗowtama ka place maɓɓe jan
waɗen joni
iya heɓa ko falaɗa
waɗen kisan
Honorable Fatou, the WHO country representative, Dr. Desta Turuni, the Director of Health Services, Dr. Mustafa Bite, the Acting Deputy Director of Health Services, Dr. Nyasi, Mr. Balaju, the Program Manager, National Eye Health Program, Mr. Sayo Kani, and his entire team that are here, colleagues from WHO, and then the team that are also working on the Sajo Kanye are also around, Mr. September, and other colleagues are also here. The media, good afternoon to all of you, and welcome to this press briefing where we are witnessing an achievement that has been registered by the Minister of Health in eliminating trachoma as a public health problem in the country. So that is a big achievement for the sector, a big achievement for the country, and the ministry feel it necessary to work with WHO and partners to organize a press briefing to inform the public as to what we have been doing as a ministry, what has happened so far, and what led us to the achievement we have registered as a country, being the second country in the African continent to eliminate trachoma as a public health problem. So on that note, I will now invite Mr. Sajo Kanye, the Program Manager of the National Eye Health Program, to give a brief overview, at least to give us a summary where we have gone through, and then what we have registered up to the time we were at the stage of elimination, until we have declared a country to eliminate trachoma.
Honorable Minister of Health, Dr. Samate, the WR, Dr. Desta, the Country Director, Site Savers, Guinea-Bissau, Mr. Balamusa Juf, the Director of Health Services, Dr. Mustafa Bite, the Acting Deputy Director, Dr. Nyasi, my colleagues from the ICAP program, colleagues also from the media fraternity. First of all, I just want to give an overview of the ICAP program, where we started and the progress made up to this level. The National Eye Care Program was established in 1986, following a national survey on blindness and low vision. In 1986, the blindness prevalence rate was 0.7%, and trachoma was 7% at that time. The population of the Gambia at that time was almost about 800,000 plus. After 10 years of hard work, there was a repeated survey on blindness and low vision in 1996. The blindness prevalence rate has gone down to 0.4%, and the trachoma has gone down from 17% to 5%. And in 1996, the population was almost about 1.2 million at that time. Then the country identified knew our problems. Then we started strategizing. SAFE strategy was implemented, was launched in the Gambia in 1999. This SAFE strategy, the S is surgery, the A is the antibiotics, the F is the facial cleanliness, and the E is the environmental hygiene. In 2006, there was also another national survey on blindness, and implementation of SAFE strategy continued until 2011, when we had the trachoma surveillance, which was jointly conducted by the Ministry of Health, Medical Research Council, London School of Hygiene, and Tropical Medicine. The country was divided into 9 zones, and out of these 9 zones, we are looking at two things: the trachoma follicles and also the trachoma tracheasis. For trachoma follicles, the country has achieved trachoma elimination in all the 9 zones. But for trachoma tracheasis, we were only able to meet the WHO threshold in all 4 zones. That means 5 zones didn't meet trachoma elimination. Then from 2013, we started strategizing, looking at doing TT case hunting, going into the community, looking at TT cases, and also working closely with partners, supplying us with equipments that we use for surgery, and also providing us with consumables. After years of hard work, we invited the consultant to come and review the eye care program to see how far we've gone, so that we can start working on the dossier. We started working on the dossier from 2017 up to 2019. Then we were advised by the consultant that we have to go back to the 5 zones that didn't meet WHO threshold to do a TT-only survey. We approached our partners again, which is Site Savers. We sat down, draw a proposal, and submitted it to them, and the proposal was approved. National Eye Care Program staffs were trained on TT-only survey. A trainer came all the way from Arusha to come and train us here to do so that we prepare ourselves for the TT-only survey. A concept paper was developed, submitted to MRC Scientific Committee. As a program manager, I went to defend it, and it was approved. Our team went into the field for 6 weeks, going into district by district to look at the 5 zones that didn't meet WHO threshold. After the survey, the result shows that Gambia has the 5 zones that didn't meet the trachoma WHO threshold have all met WHO threshold by bringing TT level to less than 0.02. Based on this, we started implementing, we started working on the dossier by writing the dossier. All key players are involved. If you look at the SAFE strategy, the S&A components are directly under the eye care program. But you look at the F&E component, we need partners. For the S component, we were providing surgeries at community level. These surgeries are conducted at health center level. They are also conducted at secondary level, also conducted at tertiary level. At the primary level, the Committee of Ophthalmic Nurses, Mr. Tamba and the team were involved in conducting surgery, performing TT lead surgery even in the patient's homes, because the surgery is extraocular, thereby bringing eye care service to the doorsteps of the patients. Our partners have been very much supportive, ensuring that consumables are available, also providing of logistics. It went up to a stage whereby patients, if they come for surgery, after surgery, they are offered $50 is transport fare, so that to motivate them to come for surgery. In that, we are able to clear our backlog. For the antibiotics, the division of antibiotics has been in 2 folds. The country was divided into 2 zones, and there was a situational analysis. The districts that are beyond 10%, we are given 2 or 3 rounds of Zitromax. That is for treatment of trachoma. The districts that are below 10%, we are giving only 1 round. For the environmental improvement and face washing, we've been partnering with Directorate of Health Promotion. TT posters have been developed. The use of community radio stations, spreading eye health messages, and also going to schools. We developed a very good comprehensive school eye health program, which was not only focusing at formal schools, but also focusing at non-formal schools. In that case, we are able to meet many children who were beyond our reach. Based on this, partners also came in, provide communities with water, good cleaning water, clean drinking water. UNICEF has been in the forefront. The Department of Water Resources have also been forefront, ensuring that the communities have water. When it comes to provision of pitch latrines, the Department of Water Resources, community development have been very instrumental. Pit latrines have been constructed across the country. We've seen communities who have been certified OD-free. So all these factors culminated in our drive towards the trachoma elimination. So it was an intersectoral collaboration which includes not only eye care program, but personnel from other sectors, like National Environmental Agency, the Department of Water Resources, you have the Department of Community Development, you have the UNICEF, including a host of partners who came in to support us, including ActionAid. So it has been a long way. So I would like to thank the ministry for taking the ownership. Because if we look at the 6 building blocks of health, one of the areas is talking about leadership. The minister have shown leadership by ensuring that they give us all the consumables and the necessary support that we need to carry out this activity. So we want to thank the Honorable Minister and SMT for the support. For the partners like WHO has been with us since day 1. Since 1986, when the first survey was conducted, WHO has been with us. They are not only supporting Trachoma, but they are also ensuring that the National Eye Care Program provides cost-effective service delivery in all the regions, including that is at all levels, primary, secondary, and tertiary level. They were also helping us to build our capacity, training of nurses, not only training of nurses, but also training of nyateros at the village level to ensure that, they'll be able to do simple awareness in the community and also referral to the health facilities. The village health workers, the community village champions have all been supported by WHO in the training. They've also trained the middle cadre of eye care personnel, that's the cataract surgeons and also ophthalmologists. So Trachoma has been, the success of Trachoma is not only eye care program, but a whole set of partners, and that's why intersectoral collaboration has been very successful in our drive to Trachoma. So I want to thank everybody, the partners who have been very, very successful, who have helped us to reach this level. Thank you very much.
Delighted to be part of this event. I think Sajja has given you a very good overview of the Trachoma program in the Gambia. So without having to repeat what he said, I wish to really congratulate the government of the Gambia through the Ministry of Health on the elimination of Trachoma as a public health problem. This is the second country in sub-Saharan Africa to achieve this. So this is something that we need to celebrate. I've been monitoring social media for the past week. It looks like people outside the Gambia are celebrating it more than Gambians. We need to be very happy, proud of this achievement. This is a big achievement. It's like when our national team qualified for the African Cup of Nations, the way we celebrated it. These are our heroes. Gambians need to be very proud of them. So I really want to thank the Ministry of Health for the able leadership over the years, the current minister and also the past. We've worked with several ministers and also directors over the years, and it has been a really challenging task, but we have achieved it. So congratulations. We are delighted to be part of this, and as Sajja said, it has been a true partnership. What we have demonstrated is if you implement the WHO recommended safe strategy, you'll get the results. And the results come through, as Sajja said, strong partnership, active community engagement, especially and also working exceptionally with the worst actors. You see, as I just said, SAFE, S and A are under the Ministry of Health. You have control over that. But the F&E component, you don't have control over that. This is outside the ministry. So this is why you need the other actors. Department of Water Resources, community development, the nyateros that we work with, the community, traditional communicators, traditional healers, they all contributed to this. As journalists, you all contributed towards this in raising awareness about trachoma and promoting behavioral change. So we need to thank all of you for the very good work that you have done. I think this is really great. And without really prolonging much, I just want to say congratulations. This is great, but it's not the end. WHO is recommending that we need to strengthen surveillance. This is not the end. We need to do surveillance. We need to collect data. We need to monitor the cases. And we need to be able to respond to those cases quickly. Otherwise, it can come back. But I'm very confident that the systems we have in place, we can maintain these gains. Why am I saying this? Gambia has an eye health training institution. So we are able to, we are training middle-level eye health workers who are spread across the country. This is sitting next to me. This is a young man, Lamin Kamara. He worked diligently. He's a cataract surgeon. He's a community ophthalmic nurse. People like Lamin were able to go to the community door to door, looking for cases, manage them, those who have trachoma, treat them, or if they have tracheasis, they do the surgery. There's a difference between trachoma and tracheasis. During childhood, we have trachoma. It's like conjunctivitis. And repeated infections during childhood, later on in life, you have what they call tracheasis. It affects your eyelids. So they turn inward, and your eyelashes will be scratching your eyes. And if that continues, you can have ulcer, and that leads to blindness. And that's why WHO is saying that trachoma is the leading infectious cause of blindness in the world. So we have defeated a very important disease, public health disease, and we need to be very proud. So we have the systems in place. Eye health workers are across the country, in all the health regions, but also we have integrated trachoma indicators into the National Health Management Information System. So for me, I'm really at ease because we have these two in place. Surveillance needs to be continued and strengthened. We thank once again the government of the Gambia, to the Minister of Health, to the able leadership of the Minister of Health. We are really proud to be associated with this, and we hope that other diseases will follow suit, because trachoma belongs to a disease called neglected tropical disease, NTD. They are neglected. There's another disease called lymphatic filariasis. People with this big foot called elephantiasis. It's endemic here. So these are things that we need to fight. I think we have 5 NTDs. We have eliminated 1. We have 4 more to go. So congratulations once again, Ministry of Health, Government of the Gambia, and thank you to all the partners, WHO, MRC, Pfizer, it's important, ITI. They donated free of charge the Zitromax, it's an antibiotic that we use to treat active trachoma. So for all of them, we want to thank them and congratulate them for all this success. It's a shared success. Thank you very much for your time.
With the presence of Honorable Minister, Dr. Samate, and Director of Health Services, and the Program Manager for the Eye Health, and the Site Saver representatives, colleagues from WHO, other partner organizations, Ministry of Health who are here, and very important, last but not least, the media colleagues who are present here. Your presence is well recognized. Today we are witnessing, a historic moment for the Gambia and for the global public health. It's not only a victory for the Gambia, it's a win for the global public health. And the Gambia has eliminated, as you have heard, trachoma. We have met the requirements. And the elimination, as you know, of infectious disease is quite complicated. It's not very simple. It involves many things. So just to clarify also about the ranking, the Gambia is the second country in sub-Saharan Africa. Africa, we have different names in Africa. Sub-Saharan Africa, we have the continental Africa. If you go to continental Africa, Gambia is the third, because we have Morocco also, which we has managed to eliminate. In the world, we are the 11th. Out of the 44 countries that are endemic, where trachoma is endemic. So this is the perspective I want to clarify also. There was a little bit of confusion on that. This achievement did not happen just like that, but rather through over 2 decades, as was presented by the program manager very clearly. It's an effort of implementation of the WHO SAFE strategy, which has been clarified. For now, you know by now what SAFE means. It's really safe. We are out of trachoma. The resolution to eliminate trachoma was passed on the 51st World Health Assembly, which was held in 1998. Since then, the World Health Organization has been providing strategic guidance and support to countries all over the world, including the Gambia, to implement this strategy. The whole SAFE strategy has been explained for you as SAFE, although order-wise it comes in a very odd order. First, surgery. Normally it's a prevention that comes first usually, but this is clear. Surgery, antibiotics, and then the facial cleanliness, which is important in the prevention, and environmental sanitation. Trachoma is a leading infectious disease of blindness worldwide in 44 countries. And it's responsible for blindness or visual impairment of about 1.9 million people worldwide. It is caused by the bacteria chlamydia trachomatis, and is transmitted through direct or indirect transfer of eye and nose discharges of infected people, particularly young children who harbor who harbor it and their principal reservoir of infection. This discharge can be transmitted through, flies also at the same time. So it's nationwide survey, I think, which was, highlighted. I don't want to repeat that one. The prevalence, how it was, and how it evolved, has been presented very clearly by the program manager. So since then, I think Gambia has come a long way and has managed to meet the criteria set. There are 3 components of the criteria set for elimination. One is about the complications arising from trachoma, meeting the 0.2% below that percent, I think. You should have that complicated type of the trachoma consequence. And the next one is about the active infection. The active infection, which is also, we have set also a criteria. I think WHO has set a criteria globally. And this one is also among children 1 to 9 years old, below 5%. And the last one is about the system. Do we have a system in place to maintain the gains that we have achieved in these 2? So if you meet all these 3 criteria, then the country is in a place where it can be declared it has eliminated. So Gambia has met all these criteria for elimination. So congratulations to the Gambia, and congratulations to the whole world also for this milestone. So the successful implementation of the strategy by the Ministry of Health was a result of strong collaboration as was depicted by the previous speakers. There were many stakeholders behind this, including the community members themselves. So a total of 3 ophthalmologists have been trained, for example, 16 senior ophthalmic medical assistants, 24 community ophthalmic nurses, 158 integrated eye health workers, and 210 Gambian community volunteers have been involved in this endeavor. So all the efforts, because of this is from the professional point of view, but the partnership also is the other perspective. The volunteers, as they are known locally as Nyateros. Yeah. So I know that's the first time I say it. Nyateros. I want to be corrected. Thank you, Nyateros. We are, complemented by the village health workers also in mobilizing community and promoting behavioral change, like the face washing is, it's a new change that you have to do. And the community health workers were supervised by trained community health nurses in their roles of promoting hand and face washing, as well as creating awareness on good eye health practices. So you have several, levels of health workers that are involved, including the volunteers. Notwithstanding the achievements, non-formal schools, especially those located in previously trachoma endemic places, remain of a concern due to the poor living conditions such as overcrowding, inadequate sanitary facilities, water supply, and basic hygiene problems. They pose a challenge of sustaining our achievements as peoples come from both within and outside the Gambia, and posing the risk of transmission across the geographical areas. The World Health Organization, the government of Gambia, will continue closely monitoring this situation so that these schools and the communities also to ensure that a rapid and proportionate response to any resurgence of the disease can be mounted also if needed. In this regard, the collaboration between the Ministry of Health and Ministry of Basic and Secondary Education, Department of Water Resource Department of Community Development, and other relevant partners will be strengthened to consolidate the gains already made so far, to increase access to clean water and environmental sanitation and sustain the gains of trachoma elimination in the Gambia. WHO, with all the other partners who are around, will continue supporting the Ministry of Health in its effort of sustaining, maintaining elimination until the problem is completely eradicated. With that, I would like to really congratulate the Minister of Health, particularly Honorable Minister, for this achievement, and symbolically hand over the confirmation letter which was signed by my Director General, Dr. Tedros. We have enlarged it so that it makes it easier for the media. This is in recognition of the efforts made and the successfully meeting the criteria actually that was set globally. So congratulations again.
Thank you. Thank you very much, Jabla. Thank you so much. Thank you. Good. Very good. Mr. Njai, Director for Health Promotion and Education, and in that capacity and in your capacity of Chairman of the Education. The WHO Country Representative, Dr. Dexter Tiruni, the Director for Health Services, the Program Manager, National Healthcare, Eye Healthcare Program, or Eye Health Program, the Deputy Director for Health Services, the Site Savers Country Director in Guinea-Bissau, who is our own, who was here before he moved to Guinea-Bissau because of the successes that were achieved here, and all your teams. I just mentioned the team leaders, but that goes to acknowledge all the team members here present, members from the WHO, the National Eye Health Program, the Site Savers, the Health Education and Promotion, and our very good partners, the men and women of the media, who support all our processes and make sure that these things get to the people, these activities get to the people in good time. Distinguished ladies and gentlemen, we are delighted once again to be with you this afternoon. It is a great honor and privilege for me to give a statement at this very important and historic event marking the elimination of trachoma in the Gambia as a public health problem, becoming the second country in sub-Saharan Africa, second to Ghana, and as mentioned earlier, the third country in the whole of Africa, and the 11th in the whole world that has reached this level of eliminating trachoma as a public health problem. The Gambia National Eye Health Program is recognized globally as a role model because of the design and strategies used to establish eye health or eye care services, which reduce blindness prevalence from 0.7 to 0.4%, a level comparable to developed countries despite a growing increase in the population. The design of the National Eye Health Program has made it possible to establish eye health services that meet the eye health needs of the population by making services easily accessible, affordable, accessible, and equally of very high quality. Since the establishment of the National Eye Health Care Program, which is now named the National Eye Health Program, following a prevalence survey of blindness and eye diseases in 1986, the leading causes of blindness were cataract, 47%, trachoma, 17%, and other corneal opacities, mainly associated with childhood measles or harmful traditional practices, which accounted for 11%. Through the government's commitment, the National Eye Health Program has been able to register remarkable achievements over the years, and one which is pursuant to our main national policy objective is creating access to quality and affordable eye health services nationally. Trachoma, which is the leading cause of infectious eye diseases, or leading cause of infectious eye disease, has been reduced from 17% to 3.6%. A 2018-2019 survey on trachoma, trachiasis, which is the advanced stage of the disease in the Gambia, found that the prevalence of the disease among people aged 15 and above ranged from 0 to 0.2%, beating the threshold required for the elimination of trachoma as a public health problem. This is a huge achievement which, compared with the mid-80s, when a national survey estimated that the disease was responsible for almost 1 in 5 cases of blindness countrywide. At the heart of the implementation of the SAFE strategy, where eye health workers and communities. At the heart of the implementation of the SAFE strategy were eye health workers and communities, including community volunteers, the Nyateros, who organized environmental sanitation activities, took part in mass drug administration, and promoted behavior change for face washing and encouraged patients to take tracheasis surgery. Our success would not have been possible without their active participation and ownership of the trachoma program. We recognize and appreciate their outstanding commitment and contributions. The elimination of trachoma as a public health problem is a significant contribution towards the attainment of our National Development Plan and the Sustainable Development Goals. We take this opportunity to renew our commitment towards the new WHO Neglected Tropical Disease Roadmap 2021 to 2030. The government of the Gambia, with support from partners, is strengthening its efforts towards the elimination of the NTDs, including lymphatic filariasis, in the coming years. This is a remarkable achievement that has saved many lives, many children, mothers, and families from preventable visual impairment or blindness, and improve their quality of life and well-being. The government of the Gambia, through the Ministry of Health, wishes to thank its partners for supporting the Gambia Trachoma program. We are particularly indebted to Sightsavers International. Sightsavers has played a very remarkable role over the years in the management of eye diseases in the Gambia and the world all over. International Trachoma Initiative, equally we are grateful to them for their efforts. The WHO for the leadership, for the support throughout the stages, and for providing the guidelines and the consultancy, and then the robust mechanisms that go to tell us where we are improving and what we need to do to improve the situation, and what we need to do to certainly achieve the kind of goals we are achieving today. We equally thank UNICEF, the Medical Research Council,
at the London School of Hygiene and Tropical Medicine, the Edward Francis Small Teaching Hospital, the Department of Water Resources, Department of Community Development, Directorate of Health Promotion and Education, Epidemiology and Disease Control Unit, Health Management Information Service, the Gambia Organization for the Visually Impaired, and the Neglected Tropical Disease NTD Task Force, and one site also for all their contribution to healthcare service provision in the Gambia. Our sincere appreciation and gratitude is also extended to Professor Hana Fall, Dr. Jere Sanyang, Mr. Ansumana Silla, Mr. Momodou Ba, and team for initiating the National Eye Health Program. It is because of their hard work with dedication they laid a solid foundation, building capacity of eye health staff and providing the facilities throughout the 7 health regions of the country. We thank all those workers who have been there in the communities, in the theaters, in the hospitals, on the wards, treating these patients, following them, providing for them the counseling services, and all their contribution. We appreciate all of your efforts. I would also like, at this juncture, to thank all my predecessors, all the former ministers, all the former officials, directors, all the former health workers who have retired probably now, but they all contributed to this process because this started 35 years ago in 1986. So many people participated and contributed to the success we are celebrating today, and I wish to thank them all. The Ministry of Health will strengthen trachoma surveillance and monitoring and supervision at levels for a period of 3 years, and as such, the support and cooperation of everyone is needed during this period. With these remarks, I wish to thank you all for your kind attention. Thank you very much.
Director of Health Promotion and Education, and the chair of this important and historic occasion. We thank you for taking these things and making sure that we have a very good program. The Honorable Minister of Health, Dr. Ahmad Lamin Samate, the country representative for WHO in the Gambia, Dr. Desta Tyrone, the country director for site savers in Guinea-Bissau, who is also a Gambian and participated in this, Mr. Diouf. Deputy Director of Health Services present here, Dr. Nyasi. The Program Manager for the National Eye Health Program and his team here, Deputy Kato, and all who are present from the Eye Health Program. Colleagues from the WHO office and all other present, the media. So my role today is a very important role. Normally the vote of thanks but today we are very happy and excited because, like one of the colleagues from WHO said, for you to have the opportunity to witness in your lifetime such an occasion is very rare. And for us, we are witnessing it. This is my second time to witness it. And all of them are happening within 2 years. So I'm really blessed as a ministry. We really need to thank Allah for that. You know, something that people cannot have in their whole life. We are able to witness 1 and 2 in 2 years. That's very big. And we are all lucky to witness that. And we hope that if we continue together, we will achieve more. Because this seems like just the beginning that we are having. Like Honorable Minister has said, he has thanked made my work very easy, but it also made it more important because he has thanked all the people and the institutions from the Nyatero, from the MRC, Water Resources Department, and some key people. So I just want you to bear with me also to just read few names. Some of them are late, and let's remember them in our prayers. These are people also who have worked very hard in this. It cuts across many years, like the minister said. So this is a work that culminated from former ministers, former directors, former program managers, since 1986. And all of them, we thank them very much. And there are a few names that I want to name. There is a lot, but bear with me, there are like 68. Yes. So one is Prof. Hannah Fall, Dr. Jere Sanyang, Mr. Ansusila, Mr. Momodou Ba, Mr. Omar C., Nurse Victoria Good, Mr. Abdullah Diba, Mr. Bakari Marong, Mr. Bakari Cham, Mr. Bakari Jaju, Mr. Kausu Ture, Madam Aissatou Aliou Job, Mr. Dauda Diouf, Mr. Mars Lay, Mr. Kebalo, may his soul rest in peace, he's late. Mr. Baba Marong, may his soul rest in peace, he's late. Mr. Usman Jallo, Mr. Abdullah Jah, Mrs. Hadi Conte, Mr. Jilibril Tamba, Mr. Abdullah Ba, Mrs. Chaku Diba, Mrs. Fatou Nyasi, Aja Jabu Pui, Aja Fatou Jamme, Mrs. Awasala, Mrs. Awanjai, Mr. Ibaseka, Mr. Ansumana Drame, Mr. Bakari Fofana, Mr. Buba Jallo, Mr. Yaya Balde, rest in peace, may Allah rest. Mrs. Salinjai, Mr. Sajo Kanyi, he's here, now the program manager. Mr. Bakari Diba, Mr. Lamin Sanyang, Mr. Mustafa Jan, Mr. Serif Ba, Mr. Ibrahim Jadama, Mr. Ibrahim Dukure, Mr. Abdullah Toure, Mr. Pa Modou Koli, Mr. Bakari Sise, Mrs. Aissatou Ba, Mrs. Hadi Sohna, Mr. Alassane Toure, Mrs. Awaloum, Mrs. Fatou Jallo, Keba Fati Driver, Alassane Trin Driver, rest in peace, Mori Keba Jawla Driver, Usman Bado Driver, Funding Kamara Driver, Aliou Kamara Driver, Modou Dabo Driver, Mrs. Ami Manjang, Mrs. Fatoumata Konjera, Mr. Ibu Jeng, may his soul rest in peace, Mr. Alaji Sanyang, Mr. Sute Job, Mr. Babukar Yabo, may his soul rest in peace, Mrs. Fatou Yabo, Mr. Kabiru Banja, Mr. Alaji Kamara, Mr. Bakari Sar, Mr. Amadou Bash, Mr. Pierre Mendy, and Mr. Abdullah Nged. And Kato. So this is just a list, it's not exhaustive, but these are among the champions who were working very hard from the beginning. And that excludes the Nyateros and also excludes the community workers. So we just want to recognize them and to thank them and to thank everyone who has participated in this. Minister has given the other list. So we also want to thank the ones who have made this program a success, because the celebration is the beginning. I think this celebration, we should do it for a whole year. Yeah, because it's a wonderful gesture that we have achieved. So we thank all partners who help us to reach this level, WHO, MRC, and all that has helped in one way or the other to do this. So we also have to thank the Honorable Minister, like what Mr. Njai said. I've been working with Bala and others, and he's been very supportive and quickly, because we've done the assessment, we brought the dossier, he had to review it, we quickly sent it, and did all the things we have to do, and then it came back, and it's positive. So thank you, sir, for the leadership, and we keep and to all the journalists who is going to help us to make this very good headlines. You have to make the headline in such a way that everybody reviews this, because this is a front page. Yes, front page. So thank you in advance for the good work you are going to do, and we'll celebrate together. So thank you very much once again for coming, and we appreciate it all. Thank you.
Wow. Love, love like fire. Xam ngeen rek affaire bi xam ngeen fan la? Skincare la. 2020 lañ wax de. Waaw. Fii nag mooy Kerr fan Kerr zero tache. Perfect skin. Skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu dee am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba laka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi di waxee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw Skincare Plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen ne lan nag waaw skin ci moom la ñu gën a xamee nag skincare products ci moom la ñu gën a xamee ñu ngi dox tamit bentey tamit si ay dàlla man waaye man nag skincare mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox Skincare Plus nag emuñ si Gambia rek ñu ngi United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes fragrances men's shirts accessories we do dresses as well we do blouses I mean we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fi mu nekk nii réew mi fii kenn waratu fi task kenn waratu fi am problème kanam kenn waratu fi am problème yi picca boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii
Love like fire. Bring my yoboguma fire. Love like fire.
I get it.
Mbijano aganyani.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyingi.
Okay. Important.
Nsila ID soto.
Sa soto. Sorry. I get it.
Mbijano.
Albaka.
Mbaka.
Bara alla service o tariaka.
Mbale.
Mo ki janna nun kunu bara tariaka.
Jannom yona forest de bureau. Gambia tonkon na no mbali ya bere. Birim koyna fo katon
bari si kodo kino katon nim fo bolon blabe
56 branches mola soto Gambia jam
ha
Gambia kono ani Gambia bantala bankol nka kodo kiya bele kodo sifa fo falindiro fo nyaadi lafta memmen na kodi topoto nin kodi maraw jannom number 1 ti nyonta andum fana nata anoda enterprise sotale wolam nyindi ko domorol fana kol fana be firale le dadi ma ni domorol ni fana beteata Gambia dawda yalo ngam fa kendol sotale je
wo moyo diat
apelenta
baraka ni me lafta nyelen kendol e bina
yalo bukani la ko la baraka ba
yalo ndel ciosano lo
baraka
We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us. Innovarex Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle. IGH has remained committed to creating the future of healthcare delivery. Gone are the days of sending loved ones outside the country for basic medical services. Innovarex Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.
When me touch down, better broke down.
With Gamtel G Fiber, now you can enjoy super fast internet in gigabytes. G Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see that.